In young individuals, the midface is important because most people desire prominent cheekbones, especially in women. These cheekbones can be enhanced using filler injections, fat injections, or prosthetics. In men, we may also need to accentuate the cheekbones, but there is a difference in how this area is highlighted between women and men. In men, we tend to emphasize the bony structure, while in women, we often highlight the soft tissue, which is the tissue that sits on the bone and moves. What is the difference? The difference is that when we smile let me think. Our face moves while smiling, and the soft tissue moves upward. If we excessively increase the volume of soft tissue, meaning when someone hasn't well defined their cheekbone, and we want to correct the cheek using filler or fat injections that enhance the soft tissue. In this case, when smiling, this soft tissue rises and appears around the eyes. So, if we highlight the soft tissue instead of the hard tissue in several individuals, during smiling, the area around the eyes becomes very prominent, making the eyes appear relatively small and poorly shaped. If someone, especially, hasn't been well defined and structured, the best approach for enhancing the cheeks is to use prosthetics. Indeed, in women, if prominence is created in the soft tissue area, it can make the face look more masculine and somewhat less feminine. Many women are aware of this state. With a little pulling of the hair, they can lift their cheeks or the midface. Many people do this with their hair ties. You might have seen the magical hair tie that some people use to lift the cheek and midface. However, there are risks associated with this method, meaning the pulling of the hair. Over time, these hairs become loose and their follicles weaken. In fact, the individual is performing a sort of epilation in this area, leading to a decrease in hair density. Gradually, the hairs in this area may become thin and sparse, and some individuals may even completely lose their hair in this section. If they want to replace it, they may have to undergo hair transplantation. In the areas under the eyes, we often see a decrease in volume, and in the early stages, we notice the formation of love points. Love points usually become apparent after the age of 30. However, in individuals who are genetically predisposed, we may see these love handles even under the age of 30. It is very common to fill love handles using filler injections or fat injections. But in older ages, when accompanied by sagging of the eyelids and cheeks, this area can be lifted surgically, and part of the love handles and sagging eyelids can be filled using surgery. Fortunately, with the injections that are performed, many individuals under the age of 45 do not need eyelid surgery. Fortunately, it can be well corrected using filler injections. Many friends, colleagues, or family members have likely seen that by using filler injections in this area, they can reduce the signs of aging. Finally, in the area under the cheeks, there may be very little tissue volume, which can lead to excessive hollowness in the face. We can address the hollowness in the area under the cheeks using prosthetics, filler injections, or fat injections. The midface should be taken into consideration during a facelift, because if the areas around the eyes are to be lifted properly, the midface must be With the use of injections, many individuals under 45 years old need eyelid surgery, but fortunately, smile lines can be well corrected using filler injections. Many friends, colleagues, or family members have likely seen that by using filler injections in this area, they can conceal those undesirable signs. Ultimately, in the area under the cheek, there may be very little tissue volume, which can lead to an excessively thin appearance. We can eliminate the hollowness in this area using implants, filler injections, or fat injections. The mid-face area should be taken into consideration during a facelift because if the areas around the eyes are to be properly lifted, the mid-face must be fully lifted as well. In young individuals, we can lift the mid-face separately from the rest of the face, which is known as cheek lifting. Many women desire their cheeks to be lifted to this high and elongated level. I can perform this lift using an endoscopic method. The mid-face is lifted in young people mainly for beautification, while in older individuals, meaning those over 50 years old, this area is lifted for rejuvenation.